Welcome to our webinar on Facebow registrations. My name is Lisa Argerbright, and today I have the great privilege of facilitating for Lori Gottschlick. Lori has, sorry, I had a little computer pop up there. Lori's been in the dental industry for 25 years. She was trained in the Air Force as a dental assistant and then worked for 13 years as a chairside assistant in a maxillofacial and prosthodontics office. She then moved to Indiana, where she worked in a periodontal practice for 5 years. Lori's been with Whitmix now for 5.5 years and is currently our educational manager as well as a sales territory manager for Canada and Central States. So before I hand the reins over to Lori, just a couple webinar tips before we begin. If you have any technical difficulties, if you're having trouble hearing us, let me know in the little text chat box down there, and then I can interrupt the program so that you don't miss out on anything. Also, there's a question box, and as the presentation goes along, if you have any questions, comments, or concerns, type those in, and then at the end of the webinar, we'll address all of those and let Lori have a little answer session with you guys. So without further ado, I'm going to pass the reins over to my friend and colleague, Lori Gottschlick. Go ahead, Lori.
Well, thank you very much, Lisa. That was a lovely introduction. And I want to welcome everybody this morning to my webinar, 90 Seconds for a Facebow Could Save You Hours in the Chair. As I was preparing to collect information to share with you today, I came across a great quote by Dr. Pete Dawson. And what Dr. Dawson said is the time and effort wasted in correcting occlusal errors that result from improperly mounted casts is far greater than the time required to avoid errors. And in the dental practice, our time is our production. And we really don't have time to waste on correcting errors. As a chairside assistant, probably one of my least favorite appointments was going into a large crown and bridge delivery appointment. It always seemed to turn out much more difficult than anticipated. And there were many times after about 30 minutes trying to adjust the occlusion, we ended up getting out the anesthesia, packing cord, taking a new impression, and worst case scenario, remaking the temporaries. And 3 hours later, we were still back to square one. Talk about wasting time. So that's why today I want to talk to you about how a 90-second Facebow record could help eliminate that potential. Understanding how and when to take a Facebow registration can certainly save you time and money. So today I'll go over just a brief history of where Facebow got started. And we'll go over what kind of information you're really collecting when you make that registration and why are we collecting it. I'll go through a step-by-step method of taking a Facebow registration using the Danar Slidematic Facebow. And then just briefly touch on how Whitmix can help you along the way and support you as you go into using some of this instrumentation. So just briefly, it was in the mid-1800s, primarily during denture fabrication, when it was recognized that there was not really a good way to orient or relate the occlusal plane to the hinge axis. And that was not until Dr. William E. Walker came up with his facial clinometer. But if we look in the history books, it's traditionally Dr. George Snow who's attributed for inventing the first Facebow, which came along in the early 1900s. Most Facebows on the market today are really quite similar, but they are arbitrary in nature. Studies do show, though, that they come within about 5 millimeters of the true hinge axis. So it's really quite accurate. And using a Facebow registration as opposed to using maybe a kinematic Facebow or taking a panographic tracing is much easier. So let's talk about what a Facebow really is, and I'm reading this from the Glossary of Prosthodontic Terms. A Facebow is a caliper-like instrument used to record the spatial relationship of the maxillary arch to some anatomic reference point or points, and then transfers this relationship to an articulator. It orients the dental cast in the same relationship to the opening axis of the articulator. Customarily, the anatomic references are the mandibular condyle transverse horizontal axis and one other selected anterior point. So basically, a Facebow is an instrument that allows you to record the maxillary arch as it sits in the patient's head, and then very accurately transferring that information onto an articulator. You can simulate the patient's mandibular movement. There are other types of Facebows on the market, and for example, we have aesthetic Facebows. And we also have very sophisticated mounting stands that allow us to mount the maxillary cast in an arbitrary position. And typically we use anatomical averages. The most common anatomical average that's used with mounting stands like this is Bonwell's equilateral triangle of 110 millimeters. What's most important in using this type of instrumentation is really recognizing when the prescribed treatment needs more than just anatomical averages. So what a true Facebow allows you to do versus an aesthetic or an arbitrary Facebow is it accurately mounts the maxillary cast in the same relationship of the upper teeth as they are in the patient's head. It also allows for an accurate record of the maxillary distance from the condylar axis. And with that information, then we can transfer the maxillary cast onto a semi-adjustable articulator, orient the lower cast to the upper, and reproduce the patient's mandibular movement or reproduce their arc of closure, getting as close as we can to how the patient actually functions on instrumentation helps minimize any interferences and certainly helps reduce the time you spend in the chair adjusting occlusions. The Facebow record also allows us to record the occlusal plane so we can diagnose any aesthetic cants or discrepancies in the occlusion that need to be corrected for functional or aesthetic purposes prior to ever even treating the patient. So let me show you how this works. As I mentioned, the Facebow is going to capture the condylar position or the hinge axis position within about 5 millimeters. And we're also going to record the occlusal plane and then take this information and transfer it through mounted cast onto a semi-adjustable articulator. And now we can reproduce the patient's arc of closure and mandibular movement and come more close to harmonizing with the rest of the dentition and the rest of the teeth in the mouth. So if we think about the Facebow as being the starting point of all of our mounted casts, I kind of think about it as being the foundation. And as we go forward in any dental treatment, we have a foundation for our reconstruction. So let's talk about some of the other areas or some of the other sequences in reconstruction where we're going to use accurately mounted casts from a Facebow registration. So we're going to talk about treatment diagnosis, treatment planning, and also patient treatment. Certainly through treatment diagnosis, if we're, I guess, practicing complete dentistry, you would say, a tooth-by-tooth approach, including diagnostic casts, a periodontal charting, or restorative charting, is really the starting point for a successful treatment plan and then treatment. Being able to work out any occlusal problems or deficiencies in the cast in your lab before going to the chair can save you a lot of time. And then how about treatment planning? How many times have you sat down with your specialty referral source, such as an orthodontist or a periodontist, reviewing your patient's case? Now with mounted diagnostic casts, certainly this is a great team approach and really gets you guys on the same page for your vision. And then what if I told you using these same casts could increase your case acceptance? Showing the patient their own teeth mounted cleanly and dressed on an articulator can be as powerful as showing them an x-ray with a periapical abscess. And that's something we do all the time. We're always trying to show patients why their tooth hurts. So just think of this as a tool when you're going through your treatment planning. And then lastly, through patient treatment, transferring this information to your lab technician allows them to certainly have the ability to make a very aesthetic as well as functional prosthesis. I'm just going to talk a little bit about what information is sent to the lab, and this is a great example. If you look at this picture initially, everything looks wonderful. We've got a great bite record that the doctor's taken, and look at how cleanly dressed and nicely mounted these casts are. But there's really something wrong with this picture. One of the things that I talked about, what a Facebow registration does, is record the occlusal plane. And so we can see clearly here a Facebow's not been used. And as a matter of fact, if you look at the occlusal plane of this maxillary cast, it's completely opposite of what would be normal in a patient. When we send our cast to the lab without the proper registration, especially a Facebow registration, they really don't have any other option other than mounting the cast in an arbitrary position. Typically speaking, they're going to mount the maxillary cast parallel to the benchtop. But unfortunately, that didn't even happen here, as we can tell with the cant. So that leads us to wonder, when is a Facebow registration really necessary? And I can honestly tell you that not every case needs to have a Facebow registration and then mount it on a semi-adjustable articulator. If the patient has a normal, healthy dentition, if they don't have any signs and symptoms of occlusal disease, it's perfectly okay to mount the case in maximum intercuspation. Or maybe even use one of the arbitrary mounting stands that I showed, or just use anatomical averages. But when you're restoring anterior guidance, or there's no anterior guidance at all, or in severe wear cases where you have to alter the vertical dimension, in cases with an anterior open bite, or any time there are aesthetic or corrective occlusal plane issues, you really want to think about using a Facebow registration. So hopefully by now I've got you at least thinking about, asking yourself when you see these cases come through, do I need to take a Facebow on this patient, or would it benefit me to take a Facebow? And just incorporating a Facebow registration in your normal examination of records appointment is a quick and easy way to take that record and have that information, that very valuable information, at your disposal. So now we're going to start talking about the technique for using the Slidematic Facebow. And before we talk about the step-by-step process, I just want to point out some of the components to this Facebow. We'll start with the measuring bow portion, and the way it works is pretty much like a caliper. You're actually able to slide the ear bow portion in and out to accommodate for the width of the patient's face or head, rather. It also comes with an anterior pointer, and we're going to be using that to help locate our third point of reference. And then we have a locking knob in the anterior position. That's going to lock in our position once we have it seated on the patient, so we no longer have that sliding mechanism. And all of our Slidematic Facebows come with 2 adhesive bevel levels, which can be used to help get your horizontal or your vertical reference point. It also includes a bite fork jig assembly, and one of the things that I want to point out with this assembly is when it's connected to the ear bow portion correctly, you should always be able to read the number 21. So hopefully everybody could see on my slide, and I'll get my arrow down here, that you can see the 2 and the 1. So as the operator, again, you should always be able to read that 2 and 1. And the reason I like to stress this so much is because this shaft assembly can be put in upside down. And we don't want to do that. We especially don't want to do that in front of the patient because it's just not going to work. Some of the other components to the Facebow that come standard is reference plane marking pen, and then a reference plane locator, which is going to help us identify our third point of reference. In this technique, I'm going to be using a base plate wax for my bite fork registration, and you'll notice to the right I have a pre-sterilized bite fork. I'm using an alcohol torch to soften my base plate wax as I form it around the fork. And then I also have a barred Parker blade just in case I need to trim any wax back so that I can seat my maxillary cast. In this particular Facebow registration, I'm working by myself, so I've added some cotton rolls to help support the fork when I have it in the patient's mouth. While I'm making adjustments to the thumb knobs and getting my positioning correct, it will support the fork. This is just a little slide to kind of remind us that it's a great idea to go ahead and have the Facebow set up before the patient even walks into the room. This way, you can make sure that you have your 21 that you're looking at, your 2 and 1, making sure that you have all the components ready to go when the patient walks in. And this really isn't new news to all of us in dentistry because we have setups that we have already prepared for the patient as we walk in. But this is just a quick reminder to help eliminate any fumbling around in getting this portion of the Facebow in correctly. Once we have everything together, I'm going to have a brief discussion with my patient because there are a lot of patients that have never had a Facebow registration before. And once you start attaching things to people's heads, they have a tendency to get a little apprehensive. Everybody finds their own comfort zone in communicating with patients, and there's really no one script that anyone can write. So just try to be brief and try to be simple. And for me, I would probably just say, Lisa, we're going to take another bite registration called a Facebow, and this is going to just help us get the position of how your upper teeth sit in your head. After I take this registration, the doctor is going to take this with the study cast that we made of your teeth, and he's going to study how your bite comes together. Is that okay? I also let them know that it only takes about 90 seconds and that they shouldn't have any discomfort from it. Just like we prepare the patient before taking a panoramic x-ray, I'm going to take a look and make sure that they're not wearing any type of hearing aids. And then I also look in the mouth because I want to make sure they don't have any removable partials or a denture or any edentulous area that we need to accommodate for. Now we're ready to start our Facebow procedure. And the way I like to start is marking that third point of reference. And our third point of reference for the Danar Slidematic Facebow is a predetermined 43 millimeters from the position of the incisal edge of the central or lateral incisor tooth. This was developed by Dr. Niles Boucher, and with this 43 millimeters, it actually will center your mounted cast in the articulator. Other third points of reference that people are commonly aware of and with other systems are the Nasion as well as orbitali. So what I'm doing is I'm taking my reference plane locator and I have the flat end positioned on the lateral incisor, and then I'm going along with my marker, and this edge is really sharp. It has a point on it, and it's so that you can really kind of see where you need to make your mark with your marker, but I always like to caution people very lightly rest that point against the patient. You may even want to touch it to your finger to see how sharp it is. But I'm just following up very lightly against the points of my reference plane locator and making a little tiny dot. The other quick tip is make sure that you remove that dot from your patient before they leave the dental office so they don't go out grocery shopping with a little red tattoo on their face. Now I'm ready to prepare my bite fork, and as I mentioned, I like to use base plate wax. Probably one of the biggest reasons I like to use this material is because it's cheap and it's readily available. It's super easy to work with. What I'm doing is just warming the wax. I fold it in half, and then you can see I'm forming it to the fork itself. Other common materials that can be used are polyvinyl siloxane materials. Probably one of my favorite is Futar D Fast Set. The reason I like it is because it sets up in about 45 seconds, which gives you plenty of time to get the registration in the patient's mouth, but it doesn't stay in the mouth very long. It also is hard enough so that when you take the fork out of the patient's mouth, it doesn't crack or break, but it also trims very easily. Two other materials that I've seen used or commonly used are compound, and then other people like to use some wax bite tabs that are adhesive. The only thing I would caution you with is those bite tabs can be a little bit technique sensitive, so just make sure that you have them adhered to your fork very well, because the worst thing that could happen is that one of those falls off after it's gotten to the lab and the patient's out of your chair, because that's going to be just your luck that that's the patient that lives about an hour away from the practice. So now I'm going to register the maxillary arch. When we're doing this, we only need to capture the cusp tips, because that's all we're seeding into that registration. We're taking our maxillary cast and we're seeding the cusp tips into the indices of the registration that we've made. And before I get going talking too much about that, we also want to make sure that we use the top side of the fork. And there is a difference. And for me, it's a little more difficult to try to remember if the bite fork stem is on the patient's right or on the patient's left. It's a lot easier for me to remember to align the midline on the fork with the midline of the patient. And the top side of this fork is the only place that we have that midline mark or that midline hash. So what I'm doing here with my wax is I've aligned it with the midline of my patient, and then I'm applying firm pressure to the fork so that I do capture those indices. One thing that I caution people against is letting the patient bite into the registration. Especially if you're using a PVS material, that material is going to flow, and you're going to capture soft tissue in addition to the tooth, and you're going to have a lot more trimming to do. The other thing is the patient can bite the fork out of position, and so now you don't have an accurate registration. Before I go forward and take the registration, I'm going to inspect the fork, and I'm looking for clear indices. I'm making sure that I didn't perforate into my material, and I'm making sure that I have three solid points of contact. With the PVS materials or the compounds or the bite tabs, there may be some trimming that you need to do, especially if you've captured some soft tissue. As I mentioned, I was flying solo with this one, and so in order to help support the bite fork in the patient's mouth, I've used some cotton rolls. I generally start placing the cotton rolls in the premolar area, and then if I need to move them anterior or posterior, depending on my fork position, I can do so. But what I'm looking for is when I put that cotton roll in the patient's mouth, I want to make sure that my teeth stay in those indices that I've made. If you position the fork improperly or you put the cotton rolls in the wrong position, that fork can torque away from the teeth. And so just very quickly take a look, make sure the teeth are still in the indexes, and then also make sure that the fork is nice and stable. Now I'm ready to connect the ear bow portion onto the fork, and it's at this time, if your patient's able, enlist their help. It really does kind of take their mind off of things a little bit. And so basically I might just say, if you could please assist me and just reach up and help me by putting these earpieces into your ear. Once we have that in place, I'm going to very lightly tug forward a little bit, because what I want to make sure is that the earpieces are in the external auditory meatus. That's going to give us our hinge position, that 5 millimeters that I talked about. And then once I have that positioned correctly, or I feel like we're in the ears, I'm going to tighten down this little dial that you see in the anterior portion on the black plastic frame of the face bow. This is going to lock in the position of my bow so it can't move in or out. Now I'm ready to capture my third point of reference. It was that little red mark that I made on my patient's face. I'll slide the anterior pointer away from its resting position, and I'm going to parallel it with that red mark. Now this is where we're really making some critical adjustments. And so you can see with my right hand, I have my thumb on this vertical shaft, and so I'm raising and lowering this vertical shaft so that I can parallel the pointer with my third point of reference, but I'm also watching that my ear bow, the anterior portion of my ear bow, is going to align parallel with the interpupillary line. And it's at this time also, if you're using the bubble level, you want to have your level right in the middle as well, your bubble to your level right in the middle. It's really easy to make slight adjustments with your thumb on this vertical shaft up and down to get your position correct. If for some reason, perhaps you have a patient that's phobic, a sight can be used, just similar to a gun sight. There's a little space that you look in here, take a peek, and then you line it up with that little third point of reference somewhere about here, and then lock everything in. Probably one of the most common things that I hear about this part of the procedure is, well, what if one eye is taller or higher than the other? And I always kind of get a little chuckle out of hearing Dr. DuPont say, well, you know, pick your favorite eye. And what he's really saying is, take a look at the face and the rest of the symmetry of the face. Pick the eye or align the ear bow with the eye that's most symmetrical with the rest of the face. Keep in mind that any little bit of discrepancies from this point on are going to be worked out in your provisional stage. Now that I have everything aligned properly, we're going to tighten clamp number 1. And actually, we're ready to store our anterior pointer. And one of the reasons I point this out is because we want to lock it in place so that it doesn't swing forward and go back into the patient's face. That could startle them. And now I'm going to step back and verify my position. And as you can see, I've got the ear bow level to the interpupillary line, and I'm right on the money with my bubble level. It's at this point now that I can lock in my bite fork with the knob number 2. One thing I forgot to mention, and I'll mention here, is that when you're locking in the knob number 1 and knob number 2, always support the ear bow with the opposing hand. And this helps minimize any torquing forces that you could put on the bow. Now certainly that's uncomfortable to the patient, but you can also alter the vertical position that you just actually tried to lock in by torquing the bow. So I can't stress that enough. Just support the ear bow half with the hand that you're not working with. Very quickly, we have a new face bow out, and it works with the Slidematics called the Quick Lock Toggle. And so if you want to make things even more simple, basically it's a single toggle that works off of a universal joint. Once you have your bite fork registration prepared, all you have to do is attach it to this Quick Lock Toggle assembly. What I'm showing you here is to tighten the knob from underneath the patient, close to the chin. This has a 360 ability of rotation, and what that means is you could actually flip that knob up to the top. You have a lot less room trying to tighten knobs underneath the patient's nose. And so this just gives you a little more room to lock that fork in place. And now once we have the fork attached, it's just as simple as tightening down one knob in the anterior position, and now you've locked your registration in place. So it really doesn't get much easier than that. I can tell you that there are times that I'll have a lab technician call me or even email me with a picture of a Facebow registration, and it has a cant to it. And they're wondering, is this really an accurate Facebow, or did it get moved when it was transported to us, or did someone make an error when they were making the registration? So while the Facebow's on the patient, just take a second to get a photograph to confirm that you do have the Facebow in the correct position. Your lab will love you for it, and it really takes out any guesswork or additional phone calls back to you. Now we're ready to remove the Facebow. The patient's ready for you to remove the Facebow, and all of this only took about 90 seconds. And so we're going to start with loosening the little knob in the anterior position right here. And I always like to be nice to my patients and arm them with tissue. Some people slobber more than others, but it's really kind of a humbling experience when somebody's taking something out of your mouth and a ton of drool comes tumbling out. So I've been nice, and I handed Lisa some tissue so she doesn't drool all over me. But what I'm doing is I'm asking the patient again to help me. I'm asking her to reach up and guide the earpieces out of her ears while I'm gently assisting and supporting the fork out of her mouth. Now we're ready for mounting. And one thing I want to point out here is that the Slidematic Facebow is called an indirect mounting Facebow, which means we're not going to attach the earbow portion to the articulator when we go through our mounting procedure. One of the great things about this type of Facebow, and there are several of them on the market, is that if you have additional bite forks and jig assemblies, basically after you've disinfected the earbow half, all you have to do is attach your extra assembly and you're ready to take a new Facebow. So while the Facebow that you just took is either in your lab ready to be mounted or sent off to your lab ready to be mounted, it doesn't render your Facebow pretty much useless. So what I'm doing here is I'm disengaging the bite fork shaft assembly by loosening this knob, and I want to make sure that I have a hold on to the bite fork itself because it's going to come out of the earbow half. I don't want it to fall on the floor. Now you're ready to disinfect the fork support as well as your earbow. The other thing I want to do before my patient leaves is tighten down my knots. It's just some cheap insurance to make sure nothing moves. So what I'm doing here is as I'm holding the vertical shaft, I'm tightening down my knob number 1, and then I'm going to hold and support my fork while I tighten down number 2. And the reason I'm supporting these opposing areas is so that I don't modify or alter the bite registration that I just took. And you're going to be surprised at how much more you can tighten these knobs. Just very quickly, an additional feature to the Slidematic Facebow is being able to register the patient's intercondylar distance in case you're using a fully adjustable articulator. Some real quick care maintenance tips. Always want to start with a sterilized bite fork. There are some other components to the Facebow that can be sterilized. I don't recommend for the longevity of your Facebow to sterilize these parts. Normal surface disinfection that you use for other products that can't be heat sterilized are perfectly acceptable by the CDC, but just in case, know that you can sterilize the earpieces and you can sterilize this bite fork shaft assembly. You just need to make sure that you remove the plastic thumb knobs on your number 1 and your number 2. The other part that does need a disinfection process is the reference plane locator because it actually goes into the patient's mouth. So just thinking out of the box, I probably would put that in cold sterilization, but I would just recommend that you sterilize or disinfect this in the same manner that you do with all other instrumentation that you can't keep sterilized. So now that I've got you interested in taking Facebow registrations and maybe even using an articulator, where do you go for additional information or just additional information on our products in general for instrumentation? Well, I'm really proud of our website. People in marketing have done a really good job of making it a very informative format for our customers. And, for example, hosting webinars like we're doing today. But as far as instrumentation, I'm going to use the Slidematic Facebow as an illustration. If I wanted to look up my Slidematic Facebow, I'm going to select my occlusion tab. And then I'm going to follow my Dana Articulator and Facebow line of products. And then you can see that I've got a red arrow that I'm tabbing onto. And that window pane is going to then slide over and reveal my Dana Slidematic. So I'm going to select that picture, just click onto that. And then a whole bunch of information is going to pop up. But I'm interested in technical support. So I'm going to click on to Tech Support. And then from that, you can see we've got an instruction manual, which will walk through step-by-step how to take the Facebow registration. We actually have a DVD or a video. It's called How Easy Is It? You can watch that. And as you can see, there's some other informative like Facebow parts list and cleaning and disinfecting guidelines. So there's a lot of information that you have at your disposal that we supply for you, and hope that you'll be able to use that in certainly in the future. I see that we're really coming to an end here of our time together, and I just kind of want to go back. In the beginning, I mentioned how I understand that in a dental practice, our time is really our only commodity. So before I close, I just want to thank everybody for taking precious time away from their day. And I want to leave you with one last quote. And basically, I could pretty much introduce patient instead of customer. And this says, to my patients, I'll say, I may not have the answer, but I'll find it. And so today, by attending the webinar, you're already seeking to understand new techniques. And then he says, I may not have the time, but I'll make the time. Investing 90 seconds and taking a Facebow registration definitely will save you time and your patient's time. And then lastly, it says, I may not be the biggest, but I'll be the most committed. And really, by following those two top promises to your patient, that automatically commits you to excellence. And if you do that, I want to commend you and congratulate you on a successful treatment and a happy patient. So again, I want to thank you for your time today. And in about just kind of some housekeeping notes, you'll receive an email in about 48 hours with a little test to get your CE credit. And below you can see my contact information. So if you have any questions about anything that I've gone over today, please feel free to use me as a resource. Thank you very much.
Thanks, Lori. We do have some questions that came through here, so if you don't mind giving some answers, that would be great.
Okay.
The first one that came through is, what happens if you use the Facebow lower than that 43 millimeter ruler? So what if someone doesn't have one of those rulers? What could happen?
Well, it will position your maxillary cast a little bit lower. I mean, remembering that 43 millimeters is going to position your cast centered in your articulator. There's it's just going to position it maybe a little bit lower in the articulator. But there's a great article out that talks about third point of references. And after you read it, essentially what they're trying to say is when you use a third point of reference, as long as you're consistent with that third point of reference that you used, you will still be able to orient that condylar position with that patient's maxilla and translate it onto the articulator.
Okay. What may cause the cast to mount to the right or left of the center of the articulator when mounting with the Facebow?
There's a couple things. One of the most common things, though, that I see and what we found out is there are some tooth mechanisms in that sliding part of the Facebow. And especially in some of the older Facebows, we found if some of those teeth break off, the Facebow doesn't center correctly. And so you'll find that the fork will be a little further off to the right or to the left. And so what I've done is I've had people take their Facebow and put it out on a piece of paper and actually make and measure out the distance from the right to the left. And if it's not equal to the center, we know that we need to either have it repaired or replace the earbow portion. I guess it's also possible if you don't have the bite fork on your toggle number 2 positioned correctly, you could be off to the right or to the left a little bit.
Next question we have up is, do you attach the bite fork to the Facebow before or after you place the Facebow in the ears?
You're going to have the bite fork position in the patient's mouth in the stable before you attach the Facebow at all. So first thing is, have the fork stable in position and then attach the Facebow or earbow half.
Excellent. All right, it looks like there's one more up here. It says, does that quick lock toggle assembly work with the current model Slide-Matic earbow?
That's a great question. Actually, yes, you can. Again, because this is an indirect mounting Facebow, the fork assembly with the 1 and 2 knobs, that's removable. So you can very easily purchase the quick lock toggle separately and add it to your existing earbow portion of your Slide-Matic Facebow. Good question.
Excellent. Well, it looks like that's all of the questions. If anyone has any other questions, feel free to email or give Lori a call. She'd be happy to help you. The webinar will be up on our website within about 48 hours. And also, like it's mentioned here on our last slide, you will receive that email so that you can get the 1 hour of CE credit. So